Lee, Senate Minority Leader Chuck Schumer says if the bill comes up for a vote this week, it has a, at best, 50-50 chance. What do you think the odds are this week? I think 50-50 coming from Chuck Schumer, that wasn't bad, actually.
No, I think that's pretty generous. I don't see how it could pass right now. When you've got those kinds of comments coming out on the Sunday shows, you can see that clearly the Republicans aren't even aligned behind what's in this bill. They don't have a clear, cohesive talking points. They don't have message. It's going to be really, really easy for the Democrats to pull this apart. They already have their talking point slamming it, and so you've got a lot of the public who's saying this is not a real plan that's going to help anybody. And I think that, unfortunately, they haven't done a good job selling it internally or externally, and I can't imagine it getting done before 4th of July. I just can't.
Yeah, I mean, I think one of the things that's going on here in Washington is Mitch McConnell actually knew that these senators were going to be opposed, Senator Ted Cruz, Senator Rand Paul. So I think he knew that. I think he's trying to get something done before the August recess. And so you saw a lot of that signaling coming out of the weekend that everybody said this isn't going to get done by the July 4th deadline. So what does that mean? They'll work on it the rest of July, try to get it done before the August recess. So I think that was really the signaling. But what's important to note is that basically what Senator Paul was saying yesterday is he's saying, listen, we're not fixing the core problem that's happening right now with Obamacare. Healthy people aren't incentivized to join the exchanges. They can wait till they get sick and then join the exchanges. And that's why you're having the cost spiraling out of control. That's why premiums are going up 100% in some areas, because I don't need to get health insurance until I actually need it. So no one's paying into the system. They're just taking from it.
In terms of the messaging, there was a Kaiser Family Foundation poll that came out on Friday, and I know Lee wants to weigh in on this too, that jumped out at me that for the first time that the Affordable Care Act, that Obamacare has a favorability of north of 50%. The favorability now is at 51% for Obamacare. That is the first month that has tipped over 50% since Kaiser started tracking it back in 2010. But it goes to the messaging and of what people understand about what the Republicans are trying to do or what they don't understand.
Yeah, I think that's exactly it, is that the general public doesn't really understand what this health care bill is all about, what is the differences. All they're seeing is the numbers from the CBO, and it's just not a really good thing. And I think it'll be definitely something to watch going forward. It's like, you know, maybe we just leave it in place, because the alternative is just creating so much turmoil and more gridlock in Washington than what we had before.
Does the CBO score matter? So we're waiting for the CBO score to come out, and the one thing with the score on the House bill was the 23 million people who will be uninsured, which virtually outside of Fox News and Fox Business, when people throw that number out, nobody pushes back on it to say, you know what, people will be uninsured by choice, because the government mandate penalties go away. So that would be somebody choosing to not buy health insurance. That's their choice. That's not people getting kicked off of health insurance.
That's right. I'm concerned about the CBO scoring coming back, because it seems to me that the Democrats are doing a much better job than the Republicans are on messaging as soon as this comes out. So anything that comes out, they're going to use to say, look, the Republican bill is not going to act favorably, and this is what Obamacare is going to do. And it's a little bit scare tactics, quite frankly. The Democrats have done an amazing job of saying we're the party that's going to take care of the people. Republicans are going to lose 24 million people. It's going to be worse than Medicaid. It's going to be worse than this. A lot of that stuff isn't necessarily even true. I mean, to act like people aren't going to have coverage for pre-existing conditions, to act as if we aren't going to allow the children up until the age 26 to stay on their parents' plans, that's simply untrue. And that's part of their messaging. And that's what you hear people parroting back to you all the time. And it's not necessarily what's in the bill.
Well, you're talking about, so Lee's bringing up a great point. The Democrats are saying, hey, you know, that Republicans, 24 million people are going to lose health care. One of the important things that came out with Chuck Schumer this weekend is he's actually said a month from now they're going to lay out a plan, and it's going to be their platform for 2018. So they're starting to coalesce together, because after what happened in Georgia, they had no messaging. They had a carpetbagger run there. They spent all their money, and everybody thinks the Democrats are in disarray. But he's actually came out this weekend and he said, hey, listen, guess what? We're going to roll out a plan. It's going to be better for the American people. So if Mitch McConnell doesn't get something done by the August recess, this is another situation where the Democrats have where the Republicans have shot themselves in the foot. But I want to bring up an important point. Today, 66% of the U.S. population is covered by their employment plans. So
Right, it's the vast majority.
It's the vast majority.
And that's one of the reasons that they're kicking the Cadillac healthcare tax way down the road.
Exactly.
It's still in there, which was in Obamacare, which is a tax on the most generous employer-sponsored plans or employer-delivered plans, but they kicked that down the road.
And the best thing in this plan is it removes the tax on investment, right? We should be
Thank you.
So
3.8%
exactly.
investment income tax.
You cannot tax investment. You need to tax consumption, and that's the issue we've had with the health care plan, the plans rolled out by the Democrats and Obamacare. So this removes that. That's the best thing in this, and they need to keep it.
But Lindsey, one thing, this leaves companies in limbo. It leaves all the health providers, whether it's health insurance, whether it's medical device makers, until the Republicans actually do something with this. You do have big question marks over giant industries in this country.
No, you do. And if you look at the stocks of the healthcare sector, that's the second best performing sector on a year-to-date basis, just under technology, double-digit gains, 15% this year. So it's quite interesting that investors are still willing to bet on the sector, despite all the disarray that seems to be going on with regards to Obamacare and the repeal process.
And really